I think it's also important, though, to mention that patients who are on biologic therapies or immunomodulatory therapies should not stop treatment, should not change the dosing frequency of their medicines unless they have symptoms which would be consistent with an infection. And particularly those ones associated with COVID-19. This would be the same advice for any infection before we had the COVID-19 pandemic, is that if in doubt, then to contact your dermatologist because stopping therapy could actually lead to significant problems. The psoriasis could flare up, and in the current climate, it's very difficult for you to be seen face-to-face in the dermatology department, and almost impossible for us to admit you to hospital if that was deemed to be necessary. So that just needs to be borne in mind, that to carry on with treatment as prescribed, and there's symptoms of infection, whether COVID-19 or other infections arise. There's been a lot of discussion in the popular media, in newspapers and on television and on the radio about whether certain medications should be avoided in the light of COVID-19. And there has been quite a lot of discussion about ibuprofen, the anti-inflammatory medicine, which is used most commonly for arthritis and for other inflammatory conditions, as to whether taking that could enhance the risk of having more severe COVID-19 disease. It is my understanding, to the data that has now emerged from King's College London, and also advice from the Department of Health, is that there is no evidence that taking ibuprofen can exacerbate COVID-19. But I guess the advice that I would give is that if one has symptoms consistent with COVID-19, such as pyrexia, dry cough, then one should take a paracetamol to manage the high temperature rather than taking ibuprofen. There are no other medicines that I'm aware of that should be avoided, particularly in the context of COVID-19, other than the ones that should be prescribed by a doctor, but that would then put someone into a higher risk category if they're on immunosuppressive treatment.